What is a virtual medical assistant? If you're a healthcare provider right now, there's a good chance you're spending way too much time updating charts and chasing paperwork, and not nearly enough with patients. And here's what I hear from providers all the time. They got into medicine to care for patients, not to spend their evenings clicking through systems or chasing down insurance verifications. But the reality is, admin tasks can eat up nearly 17% of working hours. That's almost a full day every week you're not seeing patients. So what if I told you there's a way to get all that time back without hiring another full-time employee? Hi, I'm Machu. I work with healthcare providers to build and scale their remote teams. So let's talk about virtual medical assistants. Virtual medical assistants, or VMAs, handle the essential admin work that keep your practice running. We're talking scheduling, insurance verification, updating patient records, billing follow-ups, all done remotely. And right now, they're becoming all the more in demand. Healthcare workloads are climbing. Smaller practices are getting squeezed on budgets, and telehealth is becoming the new normal. More providers are realizing that they need flexible, scalable support without the overhead of traditional hiring. Here's what we're covering today. I'm going to walk you through the real cost breakdown of hiring a VMA, what drives those rates, where you can save, and what you should actually expect to pay based on your needs. I'll also share what I'm seeing work for practices across the board. And by the end, you'll know exactly how to budget for this and what good value actually looks like. Let's get into the numbers. What actually drives the cost of a virtual medical assistant? Well, it really comes down to a few key factors: location, experience, skill level, and the complexity of the tasks you need covered. Let's start with US-based VMAs. If you're hiring locally, you're typically looking at $25 to $40 an hour. That works out to roughly $52,000 to $83,000 a year for full-time support. But there's a way to cut that cost significantly with overseas VMAs. And if you work with a trusted partner to hire someone from the Philippines, Latin America, or South Africa, rates can start as low as $3,000 a month. That's around $36,000 a year for full-time support. You're looking at up to 60% savings compared to US-based hires. And you're still getting highly skilled professionals who are trained on the same EHR systems and the same workflows. Now, I know what you're thinking. Does cheaper mean lower quality? No, not if you're hiring through the right channels. The VMAs we place at Pro have been vetted and they follow the same security protocols as on-site staff. The difference in cost isn't about skill, it's about cost of living in different regions. So what affects pricing within those ranges? Number one, experience level is a big one. A VMA with 1 to 2 years of general admin experience is going to cost less than someone with more than 5 years specializing in medical billing or EHR management. If you need someone who can hit the ground running on complex tasks like claims processing or prior authorizations, expect to pay toward the higher end. Number two, specialization also matters. A generalist VMA who handles scheduling and basic documentation, that's one rate. A VMA trained in medical coding, billing, or telemedicine coordination, that's a premium skill set and it costs more. Number three, there's task complexity. If you just need someone managing your calendar and sending appointment reminders, you're looking at the lower end. But if you need someone who can manage your entire revenue cycle, update EHRs accurately, and handle insurance follow-ups, that's more advanced work and it's priced accordingly. Here's how this looks in practice. Let's say you're a solo practitioner running a telehealth practice. You need someone to manage scheduling, handle patient intake, and keep your EHR updated. A mid-level VMA at around $3,500 to $4,000 a month can handle all of that. You're saving money compared to hiring in office, and you're getting consistent, reliable support. Compare that to an in-office admin. $40,000 to $60,000 a year with salary, benefits, and overhead. That's a 40 to 50% cost increase, and you're locked into that expense whether your patient volume stays steady or drops off. With a VMA, you get flexibility. You can start part-time at 20 hours a week, and as your practice grows, you scale up to full-time. It's lean, it's scalable, and it adapts to whatever you need. And number four, security. Some people assume remote means risky. Well, it really doesn't. Trusted VMAs use encrypted systems and secure VPNs. When you work with a vetted provider, those safeguards are already built in. So here's the takeaway. The cost of hiring a virtual medical assistant varies, but it's definitely affordable than traditional staffing. When you hire globally, you're saving on overhead and office space while getting dedicated support that scales with your practice. So what's the smartest move here? Figure out what you actually need first. Straightforward admin work, don't overpay for a senior specialist. Complex billing and coding, invest in that expertise. Match the role to the rate and you'll get the best value. When I talk to providers who've hired VMAs, the feedback is consistent. They wish they'd done it sooner. Not just the cost savings, though that's huge, but because it frees them up to actually practice medicine. They're not staying late finishing charts or stressed about scheduling gaps. They're running a tighter operation and getting their time back. All right, let's wrap up. Here's the reality. A virtual medical assistant costs anywhere from $3,000 to $5,000 a month. That's less than hiring one in-office employee, and you get flexible support, no overhead, and the ability to scale up or down as you need. So ready to stop wasting time and money on admin? Check out pearltalent.com and let's get you matched with a VMA who can actually move the needle for your practice. Thanks for watching.